It's 9 a.m. from Fox 35. This is Good Day Orlando.
All right, thank you, sir. Hey, do you feel like you're getting x-rays taken of your teeth every single time you go to the dentist? Well, often many people worry about radiation dangers and wonder if they're really necessary for dental health. So let's talk about it. Dr. Brett Zach joins us this morning to chat. Always good to see you. Appreciate you coming in today.
Thank you very much.
You know, why are these x-rays so important for guys in your field? Is this something that has to be done?
Well, absolutely. I think it's important to understand that the x-rays are the most important diagnostic tool we have outside our mirror and our eyes. When we do exams, we see about 60–70% of the tooth structure. What we're not seeing is the other 30 or 40% of the tooth structure, and that's what the x-rays help us see.
I think one of the issues here is it seems like every time we go in these days, it's another shot of x-rays. What's normal?
I think that the standard, and we try to follow the American Dental Association's recommendations. Normal x-rays in our office and most offices that I speak to are a set of cavity detecting x-rays, which would be 4 bite wing x-rays once a year. So four x-rays a year on a healthy patient.
What about the risk here? I'm sure you guys, I mean, you have to be worried about your staff too when you're talking that much radiation. Is there that much when you go in just a couple of times a year to get x-rayed?
The risk is very, very, very minimal. If you put it in context, radiation comes from all sorts of things. You can get x-rays from flying on airplanes, x-rays from eating bananas. You get x-rays just from being outside. Radiation is measured in microsieverts is how it's measured. Just from existing in the world and a daily exposure, you're going to get about 10 microsieverts, okay, just from being outside. Dental x-ray, a set of 4 per year, is less than 1. So it's very minimal when you put it in context.
Yeah, now what about, first of all, can you make the bite wings more comfortable? Am I the only one that deals with that? I mean, it seems like you're biting it. Sorry.
That's a personal thing.
That is a personal thing. Other people don't have
for
that
many
issue.
people.
But what if, okay, I go to your office,
Sure.
You say we want some x-rays, and what if I were to say to you, no, I had them last time, I don't think I want to do them this time? What would you say?
It depends on the patient. We have several patients who will request, instead of every 12 months, maybe every 18 or 24 months. And as long as that patient is healthy and we have no reason to suspect issues going on, then we'll allow that a lot of times. And that's no problem. So I think a frank, open discussion with your personal dentist is the way to go. Now, if that patient has had past history of issues or areas where there possibly other decay areas, then we will say, hey, we'd rather take them today rather than hold off 6 months to catch that early in this process.
Especially once they know that the exposure is not that much to radiation.
Correct.
Maybe that'll ease their mind. All right, Dr. Brett Zach, always good to see you. Hey, what's your website in case people want to check you out?
Sure, it's nlcdentistry.com.
Okay, thank you. Appreciate it.
Thank you.
Amy, over to you.
Good information, guys. Thanks.